There is another notion that when people are sent to CHIPS facilities, they are being demoralized, or a better word is demoted. No. How can you are serving human beings? That be a demotion? How can that be a demotion? We have specialists at Kaswa Polyclinic working there. Someone will say that they should work in a hospital, or they should go and work at Kolebu Teaching Hospital. They are specialists. The people who come for healthcare at Kaswa Polyclinic, aren't they human beings? Don't they also deserve the best? In the health system, to make the system functional and efficient, sometimes people are moved around to make sure that the system becomes efficient. Sometimes there are also problems in specific areas, and as part of the solution, you want to bring in new people that will bring in new energy. Sometimes also you look at the progress of the staff and you think that where they are not progressing career-wise the way you want them to progress. And so you want to take them to a place where they can better improve their skills and become better at what they do. So for example, in the training of doctors, for example, you train, and then even for the nurses, as a fresh doctor, as a fresh nurse, you have qualified, or you've passed all your licential exams, but they let you go and do a rotation. You are studying under seasoned nurses and doctors who have some level of pedigree in the system so that you pick up skills. I was in the Upper West region. I worked in the Upper West region for almost 2 years. Before I came to Greater Accra, I worked at Children's Hospital. Before I came to Ojagbawi, I went to St. Gregory. Before I'm here, this will not be my last stop. So it's to say that, you see, the notion that reshuffling people is a punishment is erroneous. We have to disabuse our minds of that. Sometimes the new person that is coming is going to even do better than the people that you are used to. You will never know till you experience them. So please, I would like to address a few of the issues. I think that there's a concern that the private facilities are being left behind. I think I'd like to correct that. Today, for example, we'll be having a presentation from the private facilities, and we have their secretary here. I'm sure that at the beginning of the program, the list of private facilities was mentioned, and you realize the amount or the number of private facilities that were here. It is not because we didn't extend an arm of invitation to them. We did. But over time, we've realized that many of them are not really interested in what we do. Despite that, we continue to reach out to them. We have a wonderful relationship with their leadership. And we are hoping that as you have brought it up, you ask and bring more of your colleagues on board. Because healthcare is not only about the public health system, but the private health system also complements us. So we've not neglected you at all. In fact, you are in this fight with us. And we only pray that you will be more interested in the work that we do. Many a times, because they are looking at the bottom line, it's difficult for them, that's the explanation they give us. It's difficult for them to leave their offices to come, because they are thinking about who will take care of their patients when they come, and because they also have staff issues. So you are very much on board. I mean, yourself, you know we have a relationship, we deal and all those things. But many of the other private facilities, I think it's time for them to come on board so that we can make the health system in Awutu Senya East stronger. I think that one of the assemblymen mentioned some challenges that some of the CHIPS facilities are facing. I'm happy that he brought this up because there's a lot we expect from our assemblymen with regards to the support that the CHIPS facility should have. So for example, there's a CHIPS facility that their plumbing system is not looking too good. Okay, the Municipal Health Directorate cannot come there to fix it. But there's an assemblyman, there's a health committee, community health committee. We expect that the assemblyman, when these issues are brought to his attention, he will mobilize stakeholders to support us to fix it. And that is the concept of CHIPS. CHIPS is community ownership. It is not for the Municipal Health Directorate. So if you have a chips facility in your sub-district or in your area, as an assemblyman, you own it. You have a responsibility or an obligation to own it and make sure that the facility flourishes. There are other areas where their assemblymen are doing fantastic. They are supporting us to improve our facilities, the care and security for health personnel, and that is what we expect from our assemblymen and other stakeholders in the community. All right.
Hello, Director, sorry to cut you. If you can go GBC2 for us on the chips concept, if you can translate it in the local language for all of us.
Chips, what's in there? Or the lower level or the lowest level of apomzin. Inti Maban Adjuna or take there. Chips no or your community nedi. Sabi onye aban nedi. Or your community. Inti si ebesi mamu ana what's the chips? That's our brown health workers are. BBR offer chips no hono. Wana timamufono ana wana wati brono ho. Wana wabeshe ma chips no wejina. It is a problem bi ba chips no ho. Damen kofuna assemblymen ahimfo community health management systems no ana committee members wana wabeshe na problems are chips no we facing. Why no mo onye aban na sudi. Intina our friend community based health support systems no. It's for the community. So, Assemblyman, I'm expecting that the plumbing systems in your community, you mobilize stakeholders who have resources to solve the problem. Okay? I always make an example with Amuzu Kope. Our chief was in a bad state, but we had an assemblyman who said no. He mobilized people. We got about 8 or 10 trips of sand to fill the flooded place. The health director did not have a hand in it. Yeah. There's electrical works that is going on. It is the assemblyman and some stakeholders who have come together to support. So we expect there more of that will be done in other areas. It's a chips no on your health system or your community members no. There was a question about how we do our reshuffling. Reshuffling and transfers and things, they are not always pleasant, but we take a lot of things into consideration. My boss here, Dr. Josogbe, he's worked for so many years. He can tell you, this is not the only place where he's worked. At least I know you were at Swedru, you were somewhere else, Winnie, but you like, in the health system, to make the system functional and efficient, sometimes people are moved around to make sure that the system becomes efficient. Sometimes there are also problems in specific areas. And as part of the solution, you want to bring in new people. That will bring in new energy. Sometimes also you look at the progress of the staff and you think that where they are not progressing career-wise the way you want them to progress. And so you want to take them to a place where they can better improve their skills and become better at what they do. So, for example, in the training of doctors, for example, you train, and then even for the nurses, as a fresh doctor, as a fresh nurse, you have qualified or you've passed all your licential exams, but they let you go and do a rotation. You are studying under seasoned nurses and doctors who have some level of pedigree in the system so that you pick up skills. I was in the Upper West region. I worked in the Upper West region for almost 2 years. Before I came to Greater Accra, I worked at Children's Hospital. Before I came to Ojagbawi, I went to St. Gregory. Before I'm here, this will not be my last stop. So it's to say that, you see, the notion that reshuffling people is a punishment is erroneous. We have to disabuse our minds of that. Sometimes the new person that is coming is going to even do better than the people that you are used to. You will never know till you experience them. So please, I know that sometimes it's not so comfortable. When there are issues like that, our doors are always open to discuss the issues. Oh, Director, for so and so reason, we think that this person, if we maintain her here for maybe the next 6 months, her current situation may change, then you can transfer or you can reshuffle her. We will always understand. But where people think that they have some political influence somewhere and they want to pull those strings, it becomes very messy, and then it spirals down into things that we don't want to be involved in. So, since I came into this position, my doors are always open. I mean, assemblymen, other stakeholders, they are always coming around. We're having discussions. So if there's anything that you don't understand about it, we can always judge of. But for me, my aim is to make sure that health system is strengthened in Awutu Senya East. So I want to work in the best interest of the people of Awutu Senya East. It's comfortable for everybody. But if I believe that what I am doing is in the interest of the people, I'll go ahead and do that. There's another notion that when people are sent to CHIPS facilities, they are being demoralized, or a better word is demoted. No. How can we are serving human beings? That be a demotion? How can that be a demotion? We have specialists at Kaswa Polyclinic working there. Someone will say that they should work in a hospital, or they should go and work at Kolebu Teaching Hospital. They are specialists. The people who come for healthcare at Kaswa Polyclinic, aren't they human beings? Don't they also deserve the best? Myself, I'm a senior medical officer by rank. Okay? I've done so many surgeries. Like, my life was virtually in the theater. So many cesarean sessions, a lot of things. But I go to some of the health centers and I work there. Does that reduce my pay? Does it make me less of a doctor? No. So, you see, our mentality as a people must change. If they take you to a CHIPS and save lives, what makes it so different from someone who is at a health center and probably their impact is not felt? So please, let's change the way we think. It's healthcare that we are offering to the people. If for some reason you have been at a particular CHIPS for some time and you think that in the interest of your progress as a professional, you may want to go higher, we can discuss that. But to think that you are being demoted if you are sent to a CHIPS facility, it's wrong thinking. Please, let's disabuse our minds of those things. I think that it was mentioned that some cases should be sent to the private facilities and other lower facilities. And I agree, because private facilities is business. And we do that. Maybe your facilities have not received clients yet, but sometimes when management is given at the higher facilities, we send them to the lower facilities for continuum of care. So maybe they have a cesarean session. They are sent to a smaller or lower facility for wound dressing, where they may not be able to go and come. So that collaboration is there. Maybe you have not experienced that, but it exists, and we do it a lot. So just keep your fingers crossed. One of these days, you'll be getting some patients. The issue of megaphones, I think it's a very important thing that was brought up. Myself, I feel the pain of our community health workers. They are doing a lot. The community health nurses, they are doing a lot. Vaccinations, home visits, and things. And I think that the megaphones will help. We got some megaphones a few months ago, and we distributed to them. I agree we'll work with our stakeholders to see how we can have more megaphones and distribute to them so that their burden will be lessened. I think that there was also a question on doctors on paper and doctors on the ground. Yes, that would be my last submission. So in our health system, when you work for some time, you are able to get, for example, study leave to go to school. So there's a whole process to go to school. So for example, in, let's say, Kaswa Polyclinic, you may have 9 doctors, okay, on paper, okay, but 3 of them are in school because they've qualified to leave. So they may present 9, but it may not be 9 who are working. That's why they are saying, for example, maybe 9, but maybe 4 on the ground. The other issue, when she was presenting, they mentioned that some of their prescribers have been sent to other districts to go and support them in the fight against cholera. When we were in the middle of our cholera epidemic, others came to support us because we needed their hands. So I think that it is just fair that we reciprocate that good gesture, okay, to have them support us. So I think that that is what they mean by doctors on paper and doctors on ground. Having said that, we don't have enough doctors. We don't have enough physician assistants. This is the reality of the situation. And it cuts across the whole of Ghana. We are fighting the Regional Director of Health Services and her team to try and get us doctors. But the issue is that she can only give what she has. If she doesn't have, she cannot give. So those are the challenges. It's a national issue. Thank you very much.
Director, please, you didn't touch on the motivation, the award scheme and all of
Very
that.
good.
How do you motivate your
So,
staff?
thank you very much. Okay. So no, your reward is not heavy. You are not teachers. So, I think that it's a very good thing that has been brought up. In fact, the first year when I was appointed director, some staff came to me about instituting something like that. I know that individual facilities, they have an awards scheme for well-performing facilities. Some polyclinic, they showed the DDNS's league chart and how they are looking forward to reward them. So individual facilities have that. As a health directorate, we try to do something like that. We even set up a committee to solicit for funding so that we can be able to have a district-wide program. Unfortunately, we were not successful in terms of raising the needed funding to be able to support such an activity. And so that is why, as of now, we don't have a district-wide award scheme for well-performing officers. But it's something that's going forward, I think we should look into, because our people are doing a lot. They are working very hard, and we need to reward them.
I would like to descend down to Ghanaian language so that I can detail whatever I want to say. Honorable Assembly Mai, Mr. Saubaya correction Libio, Sanse. Near Wohodadano, and Fasodudu assessor debano, in Druhoye. You don't call for more. What the existence wants have not yet achieved. Inti ese woye hoye na ensure say the Wohodadano, the Juma say ye no eye, and son out the Fufraya day about the count. Say municipal no achieve ne target na. I think say private facilities no so contribute to a lot. And then namusoma municipal no drew ne target no. And then the first time I may attend this kind of a meeting, it looks like per what I am seeing, I say private facilities no ye travel moja. Jamimi huna me ye day mekano. Inti se mo ye we no a mo hwe se private facilities no so se akwanya bi wo ho no mo a ye behwe omo a omo hihye program no ebenya omo so side no mo so neoma bi ho no omo nyina ka bomu aba se private facilities e wo ase ha no nyina so ye sei omo so ka omo neoma nyina bom no omo so ask for this point both negative and positive na no so abeka na accumulate to municipal no ne target na oye there or set because onu ni ho a facilities no so eni ho. Two, when it comes to the IT, we from NANEF are coming from the business background and we are Pan-Africans. Mr. say municipal IT team no and she say omo did the new inventive epepa say Awutu Senya Municipal Assembly no enuni private facilities e wona say now the main hospital was no ediaba now the what do you call polyclinics na was no so ediaba no mo the private facilities no so ayeden ediaba omo wie omo hwese omo digital address epeseso inti wobia wobetu kwan every area se baabia wobepa sam patemu ha no ope facility bia no ane se wagogo pe wanya facility e ben no na wa access dia ono pese oyeden woko no na wako afa bio mesre so se ho kwan wo ho a municipal no so nsan hwe se cases bi wo ho no ma enye case asese ye pagya de ko hospital na omo de aba ba dia eso sene private hospitals no omo deba na da na dia so dia so ama mo so mo send mu ndi send fanko e ma mo so nya binye.
During the presentation, I realized the data on mental health was inadequate. Looking at the two big facilities, including the Opekuma sub-district, in addition to even the municipal's presentation is low. There was no data on even a psychiatrist or a clinical psychiatry officer. A few data was captured on, I did not even see, mental health practitioners. And I think he's giving a true reflection of the mentally derailed persons in Kaswa Township. It's like when you drive through Kaswa Township, every road, you see mentally derailed people, mad people. Excuse me to use that language. I think this observation has to be looked into, and mental health have to be prioritized in the municipality. Thank you.
Agbovi Boama, Unit Committee, Kaswa Walantu. Pocho, Masem Kakra me work say, your unit have community now. Share a fear if there is problem now, get it to community. The Jumedi no share penny na same assemblyman. Now assemblyman ask my unit committee for say nim nkofo omo mantemu ho enti yen kone nkopo deru. But they will not my say nkopo no ehia wa pomuden ho ene asetrem. But to go fie baku mienu miensa na ade asa enti penifo ene yanyamu de ye besere mo. Mumbo mode ana mo get megaphone. Ma yenuam na mo ba fie no. Na money assemblyman for engage na yakojina baby na ma toho na nipa bebre atimi ati chance yebeko fie say ebo bi apono no yeda obi bi ase.
Of the target, what we are supposed to do is make sure that we achieve it and we exceed it. So even with the 95% you see, you realize that we did 100% for all. So we are not actually just working within the target. With the question of the cholera, as to why we presented on the cholera, well, I am not really sure if you were privy to how the cholera was being managed in my facility personally, but Kaswa Polyclinic was the central hub of the cholera. So when we are talking about impact, I think when it comes to human resource, it comes to finances and everything inclusive, it's actually a big story of our 2024. So we wouldn't actually have a presentation without talking about cholera, really. So that is why the cholera was there. Maybe it could have been a little bit more concise, but it will definitely not have been complete. So we started the cholera journey, and as I'm talking to you right now, because of the experiences and the trainings we got from the national level, my doctors have been released to municipal at Winneba and Swedro to help them with the cholera as well. So for that, we will still keep it in our journey. It's part of our story. Okay, thank you.
Thank you, Doctor. All right. We have a response from our regional parent.
No, I'm asking Dr. Salas a question.
Okay.
I don't want to ask so many questions, but let me ask you this one. You know, the PNC within 48 hours, you scored less than 100%. And I think that the catchphrase is within 48 hours. And those who delivered, they are not immediately discharged. So I think that this, you should be able to score 100.
Okay.
So please look at, okay. Then Dr. Dojobe, you also mentioned about outreach for newborns who are sick. And you mentioned that you had about 58 of them who were outside your catchment area. Yes, and I want to know what you did to those.
Yes, what we normally do to those who are outside our catchment areas, we normally link to the districts directors at that place and let them follow up at that area. It's a national program we are doing. So definitely those who are outside the catchment area are also covered in the program. Thank you very much. Yeah.
My last thing, the physician assistant, I think I commend her very much for, oh, she's gone out, for bringing out issues about public health. I think it's very good. Most of the times our hospitals and polyclinics, they focus on clinical and leave the public health out. But one area with AFP that we always miss is that any child who visits like the polyclinic, mother and child, if you have a child who is seriously ill and the limbs were very active, and whether it's malaria, whatever disease, and during the course of the illness, the limbs become weak, it's AFP. So we should pick as AFP.
And I think it's a public health issue to us all. So if PMTCT, you are telling me you are targeting 90%, 95%, that is what I said, I stand to be corrected. So the 5%, are they telling us that they are not going to test them? And they were also talking about the fact that they want to make sure the unborn child is not infected with the condition. So please, for PMTCT and malaria, they are also telling us that malaria, they are targeting 90%. And the 5%, they are telling us that they don't test before they treat. And we are also commenting on the fact that we should treat all cases before, we should test them before we treat. So they should take note on their target. And I think 100% for that indicator will be the best for us as a district. Thank you.
Thank you. We are done.
Definitely, we're having a lot of diseases coming to the facility. So it's not a responsibility of we, the facility per se, to go and beg people to go and do cleanup. Everybody should take it up. Every assemblyman should know that his environment should be clean. So they should assemblymen should take up and mobilize the people in the various assemblies to do cleanup, to clean the environment so that the environment will be very clean for all of us. The cholera which came to hit us, we know the focus. The new market area is a disaster. And some of us went to that place and have a look at it. It's not so good. So we are urging everybody that let the spirit of the cleaning be with all of us. It's not anybody's responsibility to come and clean your house, clean the frontage of your house, and take the rubbish away. It's a collaboration. So let assembly people take over the responsibility. The Zoom Lion are doing well, but sometimes they also have challenges. We need to assist them so that those who put rubbish at anywhere is not the best. So cleanup is one of the key things we should do and have that one. The one complaint about the water leakage at the place, I think it's just a new thing which we will look at it and work on it in a way for all of us to have that. Then the mental health and the home visits. We don't visit home to look for cause of mental health. When you have a mental health, you come to the facility. We recognize you, give you treatment, and find the cause in the hospital. The home visit is to see how well you are. And those who are defaulting, we also follow them up and pick them so that we can continue to give them treatment. Mental health, everybody has a mental health in some way. All of us have. But those ones who have enhanced, they are the one who comes to the facility and will take care of it. And as a facility, we also have psychology. So if you have psychological problems, we will definitely refer you to that place and take care. So we don't visit home to diagnose the disease. We diagnose at home, at this place. The follow-up to home visit is to make sure that you don't default. Or if any condition in your house which is predisposing you to it, we will look at it and advise. So that's what we do for that. With respect to the neglected tropical diseases, we pick them. What we did for our OPD top 10 is we are looking at the diseases who are frequently coming to us, so that we all look at the top 10, what shall shall we do for those diseases to come down? It used to be malaria, so we are working on the malaria. Now, urinary tract infection is cutting across. We also take it that one, why people are getting the urinary tract infection. It's a question we, the clinicians, are going to look at and do some few studies to find out, because we don't expect that urinary tract infection should be popping out top thing in our area. It's really a challenge, so we need to look at that one and see the causes of it. We're also interested to find out which organisms are actually causing the urinary tract infection. So we are interested in those ones for us. So I think those are the questions which I think I will respond to.